are back, and we're moving into our first conversation for this morning. We're joined by medical doctor, Dr. Johanne Perez, and he is, of course, here to help us understand some of the critical messages we've been hearing from the international health experts, from our local health experts, just what we need to know and what we need to be doing. Good morning.
Good morning.
Hi, good morning. Thank you for having me here.
Yes.
I was listening to your message earlier, and I thought that everything you guys were saying was just so important.
Yeah. So there's a lot of information right now, Dr. Perez, and I think that people are paying attention, but it's also being able to take it from theoretical to practical. And currently, the main conversation seems to be about staying home or isolating, and also social distancing. Let's break those down. What does that mean?
So it's the virus needs some place to live, basically. If it doesn't have anywhere to live, it goes away, it dies. And so the more that we stay at home, well, guess what? The more chances that the virus has no place to live.
Okay.
So social distancing, that's one of the main things that it does.
Okay.
If we stay home, then I cannot spread it to somebody else, and somebody else cannot spread it to me. There is a lot of information out there that for us to be able to hold on to, and so that things that we can do to prevent that. In other countries, let's look at what they've done. The countries who have learned to do social distancing very well, these are the countries that are able to make sure their facilities are not overrun initially.
Yeah.
And also these are the places that, where you have people being able to basically remain some semblance of normalcy in their societies.
I saw this great meme that said, the virus doesn't move. People move the virus.
Exactly.
And it was such a simple example of saying, okay, that's why you want to stay home. You don't want to be a carrier of the virus.
Yeah.
And it's particularly resistant. I don't think I've ever paid attention to how long a virus lasts on a surface, but what we've been told about the novel coronavirus, it seems pretty long.
Yeah, it does last long on surfaces. Like for example, smooth, hard surfaces like this, the virus can last up to 72 hours. But what's important here is the messaging in terms of what we can do, okay? So social distancing, clearly that's something we need to do. We need to stay home. We need to spend time with our families. We need to make sure that we don't touch our faces. We need to wash our hands. Those are things that we need to keep repeating over and over. And although you guys mentioned it, I'm sure for many days now, and this morning before I came on, and now we're mentioning these things, these are the things that we need to constantly repeat. Why? Because these need to be our new habits.
Yeah.
These are habits. I remember my grandma used to tell me, look, wash your hand before you eat. Make sure, those are the things we have to bring on and keep on.
Yeah.
I think we, as a society, just need to step up to the plate.
Yeah, and in the context of like this virus especially, and you can correct me if I'm wrong, but one of the reasons why social distancing is so important is because it's very sort of infectious and easy to spread, even in comparison to other similar or flu-like viruses. Am I right?
Yeah. Well, yeah, Gavin, you're right there. What happens with the coronavirus is that it's spread basically through the droplets.
Yeah.
Okay. That when we talk, little droplets of spit come out. So the CDC and the WHO.
That's something we love to think about.
I know, right? Yeah. The CDC and WHO have certain recommendations, and you guys are perfect examples right now of what needs to be done. They recommend a minimum right now, a distance of 3 feet. Okay. So I don't know. Let's.
Yes.
I do woodworking in my shop, so let's make sure that you all are.
We have been listening. We realize that we need to set
Yeah,
the
well,
example
there you go,
as
Gavin.
well.
You
You probably may not be able to see it from this shot,
There you
but
go.
the co-host and I do try. If you do the wide shot for me, Henry, do try to keep at least 3 feet.
3 feet.
And so
Exactly.
there you go, right? So we practice social distancing here, and Doc, well, you are perhaps the example. If you hold on to that.
Sure.
Are
All right,
the
so we are
example
at 6 feet.
6 feet. So this is the distance from Dr. Perez to us. It's the best example.
Yeah.
This is, if you really can't manage 6 feet, then this is what WHO recommends.
Right. I think you said it earlier really nicely. You said something like this would be the.
6 feet is preferable.
Yeah.
3 feet is if that's all you can get. But this is the least amount of space you should be keeping from people. And we hope that this is something you practice. We see you in those supermarket lines. We see you in those bank lines. Just tell the person in front of you, give me some space.
Yeah, exactly.
What's the difference that this causes? It feels so weird being so removed from people all the time.
Well, you know, I mean, humans are, you know, very social creatures. We like to be close to each other.
Yeah.
And this is going to be hard. This is not easy. But, you know, in times like these, we need lots of heroes.
Yeah.
And your heroes are the people who do the things that are hard, the things that are hard and necessary.
Yeah.
And importantly, right now, we can all be heroes in our own home just by doing these things. So this is a really nice, nice little infographic here, where it shows you why social distancing is so important. So, you know, if you look at the top, if we don't do anything and we keep it as business as usual, one person can basically affect about 2.5 people. And then, you know, those people then can then in 30 days infect many, many, many more people. So what we're talking about right now in terms of what me, Gavin, and you are doing is trying to reduce the exposure. If you look at the second and third lines on the bottom, that's what we want to do. If we can preferably even do the last line, that's what we want to do. So that one person can even have less chances of infecting somebody else. So that's the power that people have in their hand. I mean, you mentioned earlier, people shouldn't feel powerless here. They have lots of power in terms of what it is that they can do. And again, the best way to prevent illness is to avoid being exposed. You know, people who, Marlene, you mentioned it, that people, you could be sick and have no signs or symptoms.
Yeah.
That's what happens. And you can feel perfectly well. So what we want to do is maintain this distance. So even if you are not sick or if you're sick, somebody else around you does not get the illness.
Now, if someone has flu-like symptoms, there's a responsibility on both parts. Now, there is the flu going around. Allergy season has kicked in, unfortunately.
Absolutely, yeah.
So people may be sneezy, they may be coughing. In that case, you definitely want to keep that 6 feet. What do you recommend in that situation?
Well, if you're the person who is coughing or sneezing, there's this little term we use, cough etiquette. This basically means, look, cough in the crook of your arm, you know, because it blocks the spray of, well, little spittles, and so that will come out.
Yeah.
That's really important. And some of us, you know, if you have a tissue in hand, okay, you can use the tissue, but you do remember that you got to wash your hands after you use the tissue.
And throw it away.
And yeah, correct. That's excellent.
Yeah.
Dispose of the tissue and wash your hands. Okay, that's really important.
And what about our very common cultural practice of using a handkerchief or a rag?
Yeah, you know, I know all of us grew up with that wash rag around the place, and everybody uses it. And
when you were sick and you go to school, they sent you to school with a rag, right?
Yeah. No, the rag's not a good practice. It'll hold germs. It'll hold germs. It's easy to spread it with that. So the best thing to do is not to use a rag. Now, to cough in. Now, if you're going to go out in public and you have nothing else, do it. You know, use what you have.
Yeah.
You know, but do remember that if you do have that, you have to make sure you wash your hands right after you finish using it.
Okay.
And
But the best case scenario, not use it.
yeah, and we just saw there was another image just now of another wrong behavior, which is coughing directly into your hand or to do a fist.
Right.
And you can perhaps tell our viewers why that's bad.
Well, yeah, you mentioned that because what happens is if you cough in your hand, then what happens? All the germs get here.
And you touch
Okay,
other
and you
things.
touch stuff. And so it not only goes from, easy for you to go from your hands to the very normal things that you have in and around your house.
Yeah.
So some of the slides that are going on here, this is a great example, besides what Marlene and Gavin are doing about social distancing. You know, whenever this is the norm that we need to start to practice. And you'll see this, the business places that we go at, they'll start to ask us to do this.
Yeah.
And we need to help.
And if they haven't, you should. You should tell them.
Yeah. And you see the lines on the street, you know, I know it's difficult, you know, people are edgy, these are anxious times, but we all need to be heroes, and to be heroes, we do the hard things that need to be done. And staying in line, you know, respecting other people's distances, hey, we can all be heroes to our families, because we don't get sick, we don't take it home.
Yeah.
We keep mommy, auntie, granny, everybody healthy.
Yeah.
Oh, look, this is a great example. This is a good example there. But I see people look like they're more or less in a line and spaced out.
Yeah.
Yeah.
Oh, and actually, this is at Quality Poultry in Belize City. Am I right, Janice? Yeah. So definitely
This is a
kudos
great
to
example.
them, even
Yeah.
outside of the building, they're maintaining social distance. And this is what we can do
Yeah.
if we do have to be in a line. It seems that they have marked spaces, actually. So great job, Quality Poultry.
Good job indeed.
So looking at the fact that we are human, can we just say that? So sometimes I feel so terrible because, you know, I do touch, the hardest part is not touching my face. I may not, I have coughed and whatever it is. There are common surfaces in general that tend to be dirty that we don't think about. And we mean very dirty.
Yeah.
What are some of these places that you want to think, if I touch that, I need to go wash my hand? Like, I just touched the tape. We just all touched that tape measure. Should we all be
Yeah, we'll all have, no, not quarantine, but we all need to wash our hands
Yeah.
afterwards. So these are some great examples here, you know, things like doorknobs, your pens, the mouse of your computer, your digital devices, your home keys. Those are things you touch on a regular basis. And,
Yeah.
you know, my wife reminded me, hey, the remote control of the TV.
Yeah.
You know, those are things that, you know,
Yeah.
it might slip us. So we need to make sure that those things are cleaned on a regular basis.
Yeah, the
And-
stair banister.
Yeah, the banister needs
Yeah.
to be clean. And I guess we can also talk about how do you clean those surfaces.
Okay.
You know, so stuff that, you know, places that are really dirty, you know, and you know, soiled. What you want to do is you actually want to clean those with some soap and water first.
Okay.
Okay, that's the first, especially if it's heavily soiled.
Okay.
And then after that, you can disinfect with Clorox, with bleach. Okay.
Oh,
and
so you're going to do double the step. You're
Yeah.
going to do soap and water first.
Well, that's for like a surface that's really dirty.
Okay.
So like, let's say like this glass table, you know, looks fairly clean. We might be able to just do it with soap, with disinfectant here. But you know, if I come in and I have, you know, I was in, you know, downstairs doing tinkering around, I have like dirt, oil in my hands. I need to make sure I wash it with soap and water first and then disinfect. Right? And then the next slide, well, basically has, you know, how we disinfect in terms of, there's a simple stuff. You know, it's really important that we read the directions on the whatever the bleach bottle whatever brand we have. But a basic measure is this: 5 tablespoons in a gallon of water. Now that you know, with a gallon of water of bleach, you can do a lot
Man, that
of
Clorox
cleaning.
can last,
Yeah.
the bleach can last really long.
Exactly. And now if you look at 1 liter of water, 4 teaspoons. You know, you put, and of course, if you want to just do half a liter of water, you just put 2 teaspoons. And then that's enough of a concentration for you to really be able to clean surfaces well.
Yeah.
Okay. Now, one of the key things is when you rub the surface down and you clean it, let it air dry. Because the longer the Clorox stays there, the better it does its job. And
Yeah.
Clorox, hey, it is a super great disinfectant.
Yeah.
That's what we use in the hospital settings. If it's good enough for the hospital settings, it's really good enough for your home.
Yeah, yeah. And you know, it's key because I think people are really frantic about not getting sufficient supplies, but seeing that measurement, you know, if you have a gallon, that can last you a really long time.
It can.
Yeah.
It can. And it goes a long way in the pocket, you know.
Now, one of the places that we know that how you clean is going to be most important is, let's talk about those. So there are 2 types of people. If you have a loved one who maybe just came home from college, you know, your college, your child who's at college came home, they should be self-isolating. That is the responsibility they have. That's what they were told at the airport. They should be self-isolating. What are the details of how you do that? Let's start with that one first.
So self-isolation means that you're in a room or somewhere in the home that you're not in constant contact with people.
Okay.
That room has to, as best as you can, because we all have different living conditions,
Yeah.
but as best as you can, that room has to be very well ventilated. You want
Okay.
to be getting fresh air in there. If the person is not coughing and not actively sick, if you go into the room, that person and the person going in should maintain at least a minimum of 6 distance. Because 6 feet, sorry, because you
Yeah.
can control that.
Yeah.
Okay. And then, of course, the surfaces in that room need to be cleaned, just as we had spoken about a little while ago.
Yeah.
That person should not be going out of the house shopping. That person should not be going to visit relatives.
No.
And relatives
You shouldn't even have physical contact
yeah,
with them.
exactly.
Yeah.
And there's a lot you can do to still stay in contact with them. You know, they can be across the room from you, and you can still talk. There can
Yeah.
still be human interaction.
So it's kind of what happened with her first case. You know, she hung out with family on one night, and I think that really goes against what the concept of self-isolation is, because you shouldn't should you return back to the country assuming you have it and treating yourself that way?
Yes, I think so. I mean, because most of us travel through the U.S.
Yeah.
The U.S. has, you know, the number of cases there is really, you know, going up. And so I think to be prudent and to really, for us to practice the self-distancing, I think that is definitely a very prudent thing to do.
Now, what type of cleaning should you be doing? So here's the thing. We keep on saying give them their own bedroom and bathroom. But that's not a reality in all of this country. Some of us are lucky enough to say we have a self-isolation ward or an isolation ward in our homes. Someone can have a room and a bathroom. But what if you share? What if we have 5 people in the house and we all share one bathroom? How does that person get clean but not spread it to everybody else if they have it?
You know, these are the difficult realities of what we face, not only here, but everywhere, I mean, worldwide. And, you know, there's no real easy answer to that. I think that we just have to be innovative and in terms of our individual families. If I would have kids, you know, in the same environment like that, I would probably probably put some sort of like physical barrier up, be it like a sheet, and just, you know, if I don't have a lot of stuff, some sheets, some string, barrier that person off, put a physical barrier there. Because again, the droplets is what spreads it, and you know, a sheet, again, it's not necessarily the best thing you can do. A shower curtain might be better because that's a little bit less permeable, you know, less droplets can go through that. But these are innovative strategies we'll have to take in terms of our homes when it comes to situations like that.
And then, of course, if, you know, you are using something shared, in that sort of thing, regular sort of disinfecting and cleaning is going to be necessary.
Absolutely. That's when all of what we're talking about here about washing, you know, disinfecting, it becomes even more important. The hand washing, not touching your face. That is super critical. But as well, we don't want to share utensils with people who are in that sort of situation because it can be spread. So, you know, everything for that person is going to be theirs. You know, labeling it, putting some sort of marker for all the family to know, that's probably the best.
Or
thing.
use disposables too, right?
Or use disposables too.
Can their laundry be washed with the rest of the family? Is that safe?
You know, I would suggest that you separate the laundries in those cases. Okay, because, you know, even just handling the laundry, you know, the person handling the laundry, their hand becomes contaminated. So the best thing to do is, you know what, if they can wash the clothes themselves and they can separate themselves, let them do it. Okay. But that reminds you know, it's a good point, you know, that even like, you know, the washer, if somebody who is, you know, ill is doing the washing and they touch the knobs or whatever device they have, that device also has to be cleaned down afterwards. So there's a lot that goes into it, and that's what I'm saying about being a hero. You know, it's difficult stuff to do in terms of getting to this new norm, but we can all do something to prevent it spreading.
Yeah, and you know, speaking of handling things, what would be your recommendation? Because a lot of people, you know, both here and internationally, are now, you know, super concerned, so they're trying to take really preventative measures, and, you know, including things like wearing masks and gloves and stuff. So for the general population who wants to keep themselves sort of protected, what would be a recommendation in terms of like actual, if they should or should not wear anything protective, what should the people do?
Well, when it comes to masks are helpful in certain scenarios. If you are a healthcare practitioner, definitely there's certain scenarios. But for the general public, look, if you're sick and you're coughing, the mask is going to help. If, let's say, I was sick and I'm coughing, the mask is going to help you because I will basically be catching that spittle that comes up in the mask. So I'm preventing you from getting ill. Okay, that's one thing. The other thing about the mask is that it's something that if you're not ill, okay, it's not necessary, and we're all in here in this room, look, none of us have on masks. Okay, and that's okay. But the mask is basically to help to prevent, you know. And also special masks are in the healthcare setting help prevent the healthcare practitioner from actually breathing any sort of.
That's an N95.
N95
people keep
mask.
Hearing about.
But the masks themselves, listen, well, like if you're someone who has lots of masks at home, and you won't be using them, guess what? You know what? Tell them.
No, I was going to say, you know, it's interesting because we do get that question a lot, whether or not you should wear masks, and it's a Western world versus Eastern world thing. I think in the East, people wear it all the time as a protective measure. In the West, we wear it when we're sick. But what we're seeing across the globe is people don't have enough masks. And so using a mask right now is actually perhaps preventing your healthcare worker from having one when and if they're facing patients with COVID-19. So, you know, you want to think carefully of how you waste such a precious resource.
And there are people who've been, you've maybe getting too many masks that they will use. So
Yeah.
if you've been stocking up, maybe you can go to your, or call your healthcare center just to let them know, look, you have extra masks,
Yeah.
and you can set up something that can be given to them. There's one slide.
But it also, if you're not used to it, you touch your face more.
Oh yeah, that's actually really a good point. That with the
Yeah.
masks themselves,
Yeah.
is that you have to be careful how you handle it, because the surface of the mask outside gets dirty and the one inside. So even after you handle your mask, you got to hand wash.
Can I ask a question? A lot of people right now are making masks. Like they're sewing things together. What's your advice on that?
I was reading up on that last night, and one of the interesting things is that in countries where you have, you don't have lots of supplies, and let's say I'm a cougher, and I don't have a mask, but I absolutely need to go to the clinic because I want to go for a checkup. Guess what? I'll use a T-shirt. I mean, I don't have a mask, but I'll use anything to basically prevent people from getting ill. Okay, in those, again, innovation. It's about using what you have, and in terms of there are YouTube videos out there on how to make masks as well. Yeah.
Okay. And back to practices at home.
Yeah.
Now, if I have, let's talk about who's high risk, because we talk a lot about the elderly being high risk. I think we know that, but there are lots of other people as well.
Yeah.
There's a 30-year-old news anchor in Zimbabwe who died, but he had, I can't pronounce it right, myasthenia gravis, is that? Gravis?
I'm not sure.
It's an autoimmune disease, and I know people.
myasthenia
Yeah,
gravis,
I know people in Belize who have it.
Yeah.
So there are people who are at risk at an even younger age.
Yeah. And this, again, so if you have any diseases like diabetes, hypertension, cancer, you take medications that basically make your immune system not work as well, or you have diseases that don't make your immune system work as well, you're at risk. And this is why social distancing is so important.
Yeah.
Because you don't want to go home to your diabetic mom or your hypertensive aunt, or or even people,
or your child with asthma.
or your child with asthma. That's a great point. People that have lung disease are also at high risk. Asthmatics, as you mentioned, people who smoke. So it's social distancing is one of the main things we can do that people don't get sick.
Okay, so if I have, let's say my sister is on cancer treatment, or I do in fact have an asthmatic in my family, what should we be doing at this time?
Yeah.
We know it's in the country.
Yeah.
How do we protect them?
We protect them by basically us staying home, us staying safe, because we are the ones who are going to take care of them. Okay, keeping the distance like this.
Should they not
hand
be
washing.
moving around?
They should not be moving around. If there's no need for you to be on the street right now, if there's no absolute need, you should stay home, because if not, you can be the carrier without even knowing it. Okay, so you got to stay home. And there's a lot of benefits of staying home. You mentioned a cute story just a little while ago, and it was the same. The other day I was me and my wife were outside, and and I hear my beautiful son. I hear happy birthday in the bathroom, and these stories.
I know.
And we're just listening to my little Cito, and he's right there singing happy birthday, and I peep on him, and it was so endearing.
Yeah.
And your children, they hear a lot.
Yeah.
They listen. And so it's important that when we talk about these things as well, that we talk proactively of what we can do, because we want children to feel that they also have power to prevent this disease.
Yeah, my niece does the same. I pass the bathroom and I just hear happy birthday, happy birthday. And I look back and she's in there, 5 years old, doing it on her own.
Yeah.
So teachers and parents, you've done a great job.
Yeah.
Yeah.
And of course, this is I don't know if you can see this one, but this is a great slide here. This is a movement that was started worldwide, and I think this is important for all of us, because the healthcare workers, the healthcare team, they're at work. They're at work for you. And what's our job for them to help out? We need to stay at home. Yeah. Okay? We really need to stay at home.
And this is the concept. This is KHMH's photo.
Wonderful.
And I think that people have been sharing it a lot.
Yeah.
But let's talk about what that means. That's the concept of flattening the curve.
Yeah.
We don't talk about, we hear it in the US a lot, and in the US media.
Yeah.
What does that mean?
Is there any way we can go back to that?
I think we probably have the slide, but go
it'd
ahead.
be nice.
Yeah.
So what flattening the curve means is that if we don't do anything, okay, if we don't do anything and it's business as usual, we go to the stores, we bunch up ourselves in there, and we spread the disease quickly, a lot of people are going to get sick quickly and in a short period of time. So what that does to these heroes right here is that they'll get overwhelmed You know, you'll see, you know, we've all seen videos of worldwide of people just, you know, being packed in the hospitals and being very ill. And that's what we don't want.
Yeah.
We want people, this is it right here. So the first bump that you see there, if we don't do anything, as that bump goes up, that's the number of people that are getting sick. And that's what we don't want.
And that dotted line is the capacity, like the healthcare capacity.
Yeah, the dotted line is basically where we are in terms of healthcare capacity. And what we want is this line, the second blue line right there, the solid line. We want to make sure the amount of people that get sick, you know, because people will get sick, but that can be as gradual as a rise as possible. Why? Because it gives our healthcare system, it gives, you know, our entire society room to adapt, room to be able to get better things in place. Because we'll learn as we go. Yeah. You know, nobody has all the answers with this, and we'll be learning as we go. But that second curve, if we wash our hands, if we don't touch our face, and most importantly, if we stay home and we practice social distancing, that's what can happen. And of course, all those heroes with the masks at the clinics and the hospitals, our police force, everybody who is going to be out there, we help them.
Yeah.
You know.
Yeah. All right. Any final advice as we wrap up this segment? We also know that you work with NHI, so people right now can think of what kind of care they can access at NHI clinic. Should they go there if they don't need to? You know.
That's a great question. And I think right now, if people are not feeling well, call. Use your phone. Use technology. There are many different numbers you can call for
0800 MOH care. Yeah. That's the number you want to. So you don't have to go to the clinic and say, Doc, please test me for COVID-19.
No, you don't.
I can stay home and call.
Exactly, because you know, like you mentioned it. There's the cold is going around right now. Other illnesses that can give similar symptoms. So what we want to do is make sure we call first, and then they will basically tell you what to do. Okay.
All right. Well, thank you very much for coming in and unpacking all the messages we've been hearing. We appreciate it.
My pleasure.
All right. We're going to go ahead and take a break. Another critical conversation, Social Security and your benefits. We'll be having that conversation after the break, so please stay tuned.